Hello, my name is Dr Charles Young and I'm one of the Care Vision's directors. I help lead our research and academic programmes. In this Insights video, you'll be hearing Dr Zara Quail, one of my research team colleagues, talk to Dr Reinhard Guss. Reinhard is a clinical neuropsychologist with over 30 years' experience in the NHS and numerous academic accolades. Reinhard and Zara will be discussing mental well-being in older people, including those living with dementia.
Hi, I'm Dr Zara Quail, the research lead at Care Vision's Healthy Aging, and I'm delighted to be joined by Reinhard Guss today. Thank you so much for joining us, Reinhard, from the comforts of your beautiful conservatory, I see. So as a psychologist focused on the mental well-being of older people, what are the general approaches to healthy aging?
Okay, so thank you, Sarah. So the overarching mantra that we have in mental health and maintaining it is to remain active and engaged. And what that means is a whole host of different approaches to keeping going with things that are worthwhile, having good experiences, developing interests, continuing with new learning, lifelong learning, and physical exercise to keep the body going. It also includes relationships, building relationships, keeping our social networks going, joining groups, being in clubs, and making sure that we have cross-generational relationships and we keep in touch with younger people. It also includes developing resilience, because of course there are challenges related to aging. Challenges like ill health and developing disabilities, cognitive changes, losses and bereavement, and in order to work with those, we need to develop resilience to the things that life throws at us. And we need to develop our ability to count our blessings and to focus on the positives and what we can do. We also need to develop an ability to balance keeping going, doing things, having new experiences, and letting go of what has become too difficult and is no longer feasible.
Thank you for covering that so broadly for us. Looking now to the COVID-19 pandemic, which has been a time of unprecedented stress, particularly for people living with dementia and their carers, what advice would you give to people at home who are currently coping with the stress of the pandemic?
Yes, the pandemic with its lockdown and restrictions has been particularly difficult for people with dementia and for carers, and that's because it makes all of the things we talked about earlier so much more difficult to maintain, to organise and to participate in. I suppose the best guide for people with dementia to live well and to cope with lockdown and the pandemic that I've come across comes from the IDEAL project, who have produced this together with the National Institute of Health Research. Here it is, just to let you see, but it's freely available online too. The IDEAL project is a long-term, longitudinal study looking into the factors that help or hinder living well with dementia. And it's now in its fourth year, looking at how people are living with dementia over time. And I'm very pleased to be on the advisory group for the project. And that's why I had an early view of the supporting guide for people with dementia during the coronavirus outbreak. And again, the essential advice is not fundamentally different from what we spoke about very early on about active and positive aging, what we spoke later on about trying to live well with dementia. It's just how to keep this going during the times of a pandemic, and how to make sure that we pay extra attention to how that can be put into practice. So obviously, thinking about living well during the pandemic and retaining good mental health, we do need to ensure that we stay safe and that people have all the information that they need, especially with changing regulations and changing guidance, to ensure that people are up to date and that it's available in a format that people can understand. The next important issue is staying connected. We talked earlier about relationships and their importance. So assisting people with dementia to stay connected as much as at all possible is very key. And that's either over the telephone, that is over media. Older people very often are used to writing letters, receiving letters, writing and receiving postcards, any form of communication that is available. I know many people had, when it was allowed, grandchildren turn up, and setting up Zoom and other means of video conferencing. There are ways of setting these up so that all people need to do is press a button or click a particular point in order to be then in touch with relatives over video. Keeping a sense of purpose, having a daily routine, having jobs to do, things to carry out, activities that are important to us, again, is so key and essential. Staying active, not retreating to bed and staying under the duvet, and making a plan for how the day is going to pan out, what's going to happen when. And finally, staying positive. There are many things that are outside our control, and there is little that is helped by worrying about them. And it's focusing on the positives, focusing on what we can do, focusing on what might make things more positive to live with at the time. So those are the essentials, and of course everyone would put those into practice in a slightly different sort of way, but as long as we can keep those essentials in mind, that would be the key aspects of advice for living well with it during the pandemic.
As a healthcare professional in the mental health sector, what daily activities or practices do you do in your own life to help maintain good mental health in the process of healthy aging?
I suppose to me, having a sense of purpose is one of the big issues of aging, and I suppose I have acquired all this knowledge and skill over a very long period of training and work, and it's continuing to make some positive use of that. That's important to me. Relationships with family, friends, colleagues, patients, and with the wider world. It's learning new things. Lifelong learning is one of the things I've picked up along the way, of just how important that is. So seeing new things, learning new things, experiencing new things. And then there are my particular hobbies and likes. I enjoy plants and plant life, watching things grow and watching them develop, both in my plants indoors and the garden. and I've been developing my creativity more. I used to paint and draw many years ago, but I have finally found time to pick that back up again and do some more of it. I'm very poor at the physical exercise part, but my excuse is that going for walks, that walking around my garden, doing the physical exercise of bending, weeding, schlepping and carrying might make up for a bit of that.
Wonderful. I'm a very keen gardener myself, and we certainly know the benefits of being outdoors in nature.
Right, I probably get that in the garden, but yes, absolutely, that's my therapy and reflection space.
In the second part of this interview, we will hear from Reinhard Guss about psychosocial interventions for people living with dementia and their carers.